Okay, welcome back to Smarter Athletes Part 4 on injury management. We're going to take a look now at sports medicine and the roles specifically that exist within sports medicine when it comes to injury management. And if anything, this is just going to kind of give you a little bit of guidance or a heads up in terms of what's out there and who really specializes in what line of work. There are tons of people out there who will let you know that they are a jack of all trades when it comes to sports medicine. They can help right from the very start, the early onset, the diagnostic process, right through the rehabilitative process, making sure that you get back on your feet. And I'm not going to say that's not true. I think that there are definitely people out there that work that way. But one of the most unfortunate stories, and it's actually fairly common in sports injury management, is that an athlete goes so long with an incorrect diagnosis or an issue that has maybe another underlying issue that wasn't necessarily detected or treated by their sports medicine professional of choice. And if anything, what we're going to try to do here is give you a little bit of insight when it comes to the role of sports medicine and the variety of sports medicine practitioners that are out there and who can really specialize in what area, so that you have a better approach if and when you do ever have to kind of cross paths with injury management. And if you're an athlete, you will if you haven't already. So here we are. We're understanding different professions in sport medicine. If you've watched our first module, that was building better strength for the sake of injury prevention and understanding the differences between chronic and acute injury. And really, we spent most of our time trying to understand those differences. But I kind of highlighted the idea of building better strength for the sake of injury prevention, because that's what we're always going to come back to. We're going to come back to how do we kind of prevent that from happening in the first place. When it does come to sports medicine, when it comes to trusting these people, there is an order of operation. And regardless of who's actually filling these roles, I think we want to make sure that we're checking these off as we go, that we're starting at the top of this list, that we're not kind of starting in the middle or near the end. Sports medicine professionals support a variety of athletes in a variety of ways, all right? So everything is warranted. Everything out there is there for a reason. But when it comes to managing injury, we need to know where to start. And we need to make sure that we're following the right order. So when we talk about assessment and diagnostics happening at the very beginning, there's a good reason for that. I think it's fairly common to skip over that pretty quickly, but we're talking about making sure that we have the right person who's capable of making an accurate diagnosis, looking at our injury. And oftentimes this means going beyond your family doctor. There are so many great family doctors out there, but they go to medical school for 6 years to study almost everything in the book of medicine. They don't spend several years focusing specifically on sports injury, different different types of sport injury, different causes of sport injury. They don't do that. They might spend a little bit of time on sport injury, but if they're family doctors, they're general practitioners, they are not sports medicine doctors. So oftentimes assessment and diagnostic is best done by somebody who practices sports medicine. So right away, this is a fairly common mistake, especially in youth athletes. They go to their family doctor. Their family doctor makes a half decent, if they're lucky, diagnosis on what the cause might be, and if they're lucky, they'll get pointed in the right direction. But oftentimes there's misdiagnosis happening right off the beginning when it's left up to a family doctor. After that, after family doctor's seen, hopefully there is referral to the correct sports medicine practitioner. And after somebody in sports medicine has a chance to look at the injury that you're dealing with and we can firm up on the diagnosis, then it's on to treatment, management, and rehabilitation. And that's kind of where I come in, and a lot of people that work in similar lines of work. If it's not strength and conditioning, it might be chiropractic care, it might be athletic therapy, it might be physiotherapy, it might be massage therapy, but that's where we fall, on that third line there. And then we talk about reassessment for clearance. And this is where we need to get a little bit of help from our sport-specific coaches. We need to have people who know how our bodies are normally capable of moving under normal circumstances to take a look at our movements, to see that we're not still making anything that we would call compensatory, moving our bodies differently because maybe we're still dealing with a little bit of injury, those kinds of things, to do a proper reassessment and hopefully provide us with clearance to return to play or advance through the training protocol that get us closer to returning to play. So on a checklist, this is basically what we're looking at. We're looking at assessment, followed by diagnosis, followed by prognosis. Prognosis is important. That's when we're saying, what caused this? All right, we're saying, okay, I'm having a look at this injury. I can pretty firmly diagnose it as such, but we actually kind of want to know why it happened. A lot of the times it might be fairly obvious why it happened, especially if it's an acute injury that involved a collision or a singular event. But if it's a chronic injury, that might involve a little bit more deep digging in terms of a prognosis. After that, it's referral, making sure the right sports medicine people and the right rehabilitative strength work people are getting involved. And that's when we work on treatment and rehabilitation. Finally, we talk about clearance, reconditioning, retraining the body after that to make sure that this thing's not going to happen again or not going to happen nearly as easily. And then finally, reevaluation for return to training and conditioning and play. Okay? So if we want to line everything up on this checklist with the right people, that's what's happening over here on the right. When we look at assessment, that's the very first thing that happens when the athlete comes off the field with the injury, for say, and we're talking about maybe somebody like an athletic trainer on the bench or a first aid professional. And after that, diagnosis, prognosis, and referral should all be coming from a sports medicine doctor. And this is where I can't really stress enough that a family medicine doctor is probably not the best person to be seeing here. You might need a family medicine doctor to refer you to a sports medicine doctor if you don't already know one or have access to one, and that might be okay. But after that, it should be a sports medicine doctor taking a look at the injury, making a firm diagnosis, hopefully identifying how it has happened, and providing you with referral to the right athletic therapy, physical therapy, strength and conditioning people. All right. Following that, we have treatment and rehabilitation. That is where people like me come in. And after that, it should actually be back to the sports medicine doctor. The sports medicine doctor for some kind of clearance saying, okay, well, this looks good. This looks like to have improved, and we should probably re-enter some sort of training environment. Then we look at the sports medicine doctor and say, well, we need to kind of align with coaches and strength coaches here to say, okay, is this body moving as good as it did pre-injury or maybe even better than it did pre-injury, or do we still have some work to do? And then a final reevaluation coming from sports medicine and hopefully a coach as well. Okay, so when we look at sports medicine and rehabilitation individually, this is kind of a helpful chart here for some people. If we're on the left column, we're looking at our sports medicine doctors, athletic therapists, massage therapists, physiotherapists, chiropractor. This is only here because a lot of the time it's fairly confusing. And what I was talking about a little earlier on when I say there's a lot of people out there will definitely claim to be a jack of all trades when it comes to managing injury or diagnosing injury. That might be true. There are definitely people out there who are so well studied in this kind of stuff that they probably are pretty close to jack of all trades when it comes to sports medicine. But in that middle column, that is their actual specialty. By trade, by definition, by training, this is what they do. So if it's somebody in sports medicine, what they do is diagnosis, referral, follow-up, assessment, reassessment. In some cases, there's surgery as well. What would you need their help for? In addition to assessment and diagnosis, these are the doctors that are going to give you referral to the right people to help you out with a little bit more of a hands-on process. Maybe you'll need something like an MRI or a bone scan or some other form of diagnostic imaging, and it's a sports medicine doctor who can actually refer you to those kinds of things, right? A chiropractor, athletic therapist, massage therapist, they can't write a referral for an MRI or an X-ray or anything like that. An athletic therapist, though, is somebody that can provide you with hands-on treatment of an injury and ongoing monitoring. An athletic therapist is going to treat and monitor injury with your return to athletic activity in mind. So this is somebody who's gone through training and programming that's designed to kind of operate through an athletic lens. A physiotherapist working a little differently than an athletic therapist is somebody who's maybe just trying to get you back to work, get you back to a situation where you are mobile and stable, but maybe not necessarily athletic. And this is a pretty key or important thing to understand. An athletic therapist is hoping to return you to sport, and they're trained to operate that way. Whereas a physiotherapist, unless they've done some additional training or some additional work, they might not always be looking through that same lens, right? Massage therapy, treatment of soft tissue involved in an injury or injury prevention. All right, so somebody who works in massage therapy, usually working on soft tissue. So they work on areas of muscle that are in a state of high resting tension or chronic stress. And this is going to help reduce the influence of an injury or potential injury. So a lot of the time, massage therapist is there from the prevention side onward. Shouldn't just be somebody you're looking for help from after you get injured. We talked a little bit about the physiotherapist already in the second row from the bottom. Again, hands-on treatment. They use the same therapy modalities that an athletic therapist might use. But again, similar treatment methods, but may not necessarily specialize in treating athletes. I'd always be highly recommending the athletic therapist over the physiotherapist in most situations, just because of that variable alone. They've probably worked through an athletic lens with more hours, more athletes, and are more familiar with athletic injury, and not so much injuries that are caused by just chronic overuse in everyday life. And lastly, we have the chiropractor. The chiropractor is a little bit different from the athletic therapist, massage therapist, and physiotherapist. They specialize in musculoskeletal assessment and joint manipulation when it's appropriate. So this is sometimes actually, bone movement. A chiropractor specializes in alignment and musculoskeletal development. So they can identify and treat injuries or issues that are related to any kind of musculoskeletal influence. This could be caused by a chronic or repetitive stress. It could also just be caused by growth and development. It could be caused by poor patterns of movement or poor patterns of just static positioning. So somebody who does a lot of sitting or a lot of video game playing or a lot of things that cause like an anterior dominant trend, a chiropractic practitioner is somebody who's going to be able to help you with that. Now, a good chiropractor is not just somebody who's going to kind of make some adjustments on your body and send you out the door. A good chiropractor is going to be somebody who looks at this from a cause and effect relationship standpoint and says, okay, well, this is the issue, this is probably what's caused it, and this is how you need to treat it when you're on your own. This isn't just something that we put a band-aid on and I see you in 2 weeks and put another band-aid on it. It is something that we look at from more of a cause and effect standpoint, and we say, how do we kind of fix this and how do we work on maybe some of the muscular influences on this and hopefully create better alignment long term. And there's some subtle differences between them all. Hopefully this chart helps a little bit with recognizing who those treatment professionals are and how they might differ a little bit. All of this really involves the role of the athlete. Okay, so regardless of who you might be relying on from this previous slide, at the end of the day, the athlete plays a role in injury management no matter what. So in every level of sport, whether it's amateur all the way up to professional, the athlete is most responsible for success when it comes to injury management. And this really starts with a proactive approach. It has to involve somebody looking at, what could cause an injury and how do I prevent that injury from happening? Um, what are the early warning signs of those injuries? And how am I making myself the least vulnerable and the least at risk to a certain injury? So athletes who don't have the education on these areas, they're already at a greater risk, right? And you're missing an opportunity to reduce risk if you're not learning about what those injuries are and how they're most commonly caused, okay? So taking this approach and educating yourself about what the injuries that most pertain to you with respect to vulnerability and risk, that's something that should start right from the high school aged athlete. So it should be starting now if it's not started already. And this should involve continuous assessment of your own movement, of your own biomechanics, and continuous assessment and reassessment of whether or not your strength and conditioning work is working for you from a maintenance standpoint. And simply put, I gotta say, as a strength and conditioning coach, maintenance work is boring. And a lot of people don't want to do it. And a lot of people park it at the end of their workout. They say, okay, I want to do all these awesome exercises that I really enjoy doing first. And if I have time, I'll do some of these maintenance based exercises. And oftentimes when they do that, they're so deprioritized that they just leave them out altogether. And after 7 or 8 months of training, they've only really made sure they've done their maintenance exercises 40 or 50% of the time. And that's not nearly enough. And there's not enough maintenance work that's been done. And as a result, the athlete's at a greater risk of injury because the maintenance work or the maintenance exercises were boring. And they don't really have any solution to that other than to say you have to do the boring work. Serious athletes do the boring work, and the maintenance work is boring. I'm sorry. There's no real way to sugarcoat it or make it sound any better, but it's been something that I've probably been saying for the last 10 years. And the best athletes are the ones that have kind of heeded that advice and who have just said, okay, I'll do the boring work. I'll do the maintenance work. And when it comes to strength and conditioning, it is my role to make sure that it's in there. It is my role to make sure that athletes understand the value of it and that it is a key focal point. And it should actually be a priority. Now, we can embed maintenance work right into a warm-up. We can also call it something like corrective exercise, right? And it doesn't really matter so much as what we call it, whether we say these are exercises designed to correct an imbalance or it's related to kind of offset overuse. At the end of the day, it is maintenance work. It is not the big primary mover work. It's not high speed, high intensity, explosive work that's going to make you sprint faster or jump higher or increase your bench press. It's corrective exercise. And whenever possible, corrective exercise should be programmed with a progressive intention. So we're looking to make sure these exercises do challenge you, but they challenge you in ways that challenge your stability or challenge your coordination. They challenge your balance. They're certainly not challenging your overall force production. And again, this goes back to it being fairly boring. So the level of difficulty and the overall complexity of the exercise does increase, um, but it increases in a way that that challenges other areas, not just raw strength. And this is where I have a lot of trouble selling people on the idea of progressive challenge when it comes to corrective exercise work. But it's so important, and it's something that I believe in and have been pushing on people for the last decade, and with fairly decent success. But at the end of the day, it's always a shame to see people who neglect the idea of involving and prioritizing corrective exercise ending up hurt because of it. This is an example of what a progressive exercise would look like if we had something in a program that was a progressive series of exercise to improve ankle stability. We have the levels down the left-hand column. The focus and the intention is clearly identified in that middle column. So starting with level 1, we just want to reintroduce this athlete, say they've sprained their ankle, to just minor proprioception and changes in stability. So we have them doing a drill like standing on one foot for 20 seconds at a time and doing a supported single leg quarter squat with one hand on a chair. All right, and that's a level 1 version. And when they're ready to progress in level 2, we're trying to enhance that proprioception and reintroduce stability on minor impact, so some very gentle landing. So now we're doing that single leg stance with some upper body rotation. So perhaps now they're standing on one foot, but they're holding a medicine ball in both hands, and they're moving 90 degrees to the left and 90 degrees to the right with their upper body twisting on that standing leg, right? And then they're doing a single leg stand and stick or land and stick from like a 2 to 4 inch high drop and just kind of trying to stick and balance that landing. A level 3 progression would now involve some advanced proprioception and postural control, and we'd increase the amount of impact stress as well. So now we have a single leg half squat, and we have them pausing and then doing a little hop and then sticking the landing. So there's a little bit more intensity there, and the squat flexion's a little bit more as well. So it's a little bit more stress on the joint. And we have them doing a single leg lateral hop over a low like hurdle, maybe 3-4 inches tall. And then a final level 4, we want them clear for sport-specific stress and reactive ability, so we have them doing some high-speed, multi-directional agility drills. Maybe they're sport-specific, so if this was a basketball player, they're doing the exact same drills as their peers and teammates in a controlled environment. And we have them doing some maximal or submaximal plyometrics as well. And so, again, none of this is exciting work, right? It's all work that I would consider to be fairly boring when in the grand scheme of things with strength and conditioning. But it's very clear to see the progression through these 4 levels, and it's really important that an athlete kind of takes this approach to an injury rehabilitation when it comes to strength and conditioning. And to be clear, and I think this goes without saying, no athlete should be returning to play and competition in sport-specific training before they can kind of put the check mark on that level 4. And I say that it goes without saying, but oftentimes this wouldn't be true. If I had every basketball player I've ever worked with who's gone through ankle sprains, if I had them all making sure they could do this level 4 work without pain and doing it perfectly before returning to the hardwood, we'd probably have a lot more success with total rehabilitation of an injury and reducing the likelihood of re-injury. Anyway, that's the end of part 2. Thanks for watching. If you have any questions or concerns, you can reach out to me by email. Address is up there on the screen, or you can get me through the website, strongerbcss.ca. Thanks so much for watching.